Soft drinks may have harder consequences than once thought. This is according to a new study from the Mass General Brigham Health Care Institute. And our medical expert, Dr. David Winter with Baylor Scott & White, joins us to explain. Good to see you again.
Good to see you, Kara. Good to be with you.
You know, I'm going to be honest, this one hits close to home. I don't have a lot of vices, but soft drink is one of them. So let's talk about the type of soft drinks you're talking about.
Well, you're in a good crowd because the Center for Disease Control says that 2/3 of Americans drink at least one of these every single day. Now, soft drinks are non-alcoholic beverages. They're usually carbonated and they contain sugar or corn syrup to make them sweet. And they've been linked with cancer of the liver, the breast, the colon, and most recently linked now also with cancer of the stomach. We're not sure the link. Well, why does that do that? Is it because of the sugar? Is it because it causes obesity? We're not really sure, but there's caution about drinking too many of these in a day.
So what about diet drinks? Are they an issue?
They have no sugar, they have no calories, so no. In fact, the World Health Organization is on a big campaign to say diet drinks may be okay, but ones with sugar in them or corn syrup in them, they should be limited to at least less than 10% of your total calories in one day. More than that, they say, worldwide, is going to cause more problems, particularly with some cancers.
Yeah, and I have a feeling that if you're drinking one, you might be drinking more than one. Okay, so let's talk about alcohol. Any new reports on that?
You know, for a long time, there were studies that showed that people that drank moderately, a drink or two a day, were healthier than folks that didn't drink. But they've gone back and looked at those, and they found that folks that didn't drink in that category, a minority of those folks didn't drink because they had alcohol problems, liver problems, kidney problems. Take that minority out, and those folks actually are healthier than folks that drink. So we can't say that alcohol is healthy for you, just in moderation. That's the key with that.
Okay, so do they link any differences between wine, beer, liquor?
Not until recently. And in England, they've said that, okay, you've got alcohol, liquor, you've got beer, and you've got wine. And actually, if you drink wine, it's actually safer, they say. Now, other studies will say that's not really true. It's really how much you drink. And men should drink no more than 3 drinks a day, women no more than 2 drinks a day, and that actually is safe. Not necessarily good for you, but safe. More than that can get you into trouble. That's what the most recent studies are showing, Kara.
We're also seeing that fewer people are drinking, alcohol. A lot of mocktails now. The younger generation is taking a different approach. We've done stories on that here at Daybreak. And so my question is, mocktails, are they better? I mean, I know they still have sugar in them, though.
Well, if they have sugar in them, you got the same problem as soft drinks. So I would say no with that. Otherwise, they're probably safe. But I got to emphasize, the safest thing you can drink is good old water. It's very good. The best thing that hydrates you. So water is safe, and it's very good, and it's very inexpensive. That's my favorite.
I know. It's not near as much fun, but you are correct. Thank you so much, Dr. Winter. We appreciate it.
Thank you, Kara. Good to be with you.